After more than 220 COVID deaths linked to aged care, an apology of sorts from the Prime Minister.
On the days that the system falls short, on the days that expectations are not met, I'm deeply sorry about that. Of course I am.
But forceful pushback from Scott Morrison at damning claims heard by the Aged Care Royal Commission that the Commonwealth lacked an adequate plan.
We completely reject the assertion that there was a plan, not a plan, because there was a plan.
If this is a plan, I'd hate to see what it would be if it was unplanned.
The Royal Commission also heard evidence that the aged care sector still remains unprepared.
That is a statement that has been made by the council assisting. So that is not a finding of the Royal Commission. That is a position that has been asserted.
The Royal Commissioner did call on the government, though, to establish a dedicated aged care national coordinating body.
What we've set up, in fact, in Melbourne is this Victorian Aged Care Response Centre.
The matters that were raised that needed to be addressed very much mirror the actions that the government has indeed been taking.
Quite clearly it doesn't mirror that, because that's not a national coordinating body in place in one state.
Appearing before the Senate's COVID committee, Health Department Secretary Brendan Murphy on the attack, taking issue with the claim 70% of Australia's deaths have been linked to aged care.
On this measure, we're one of the worst performing countries in the world.
We find that a very misleading conclusion. We've had tragic deaths in aged care, but it's only 0.1% of aged care residents compared to 5% in the UK.
Frankly, that sounds like a degree of self-congratulations.
That 0.1% was not in any way self-congratulatory. It was merely to try and point out the context of the somewhat ludicrous conclusion that the percentage of deaths in aged care was somehow, by international comparisons, bad.
Trudy McIntosh, Sky News, Canberra.